Let me share my screen. Okay. Hi, everybody. It is the 29th of March. I can't believe it. April's only a few days away. April Fool's Day is only a few days away, which I don't know. We've got to think of some, what do you call it, tricks you can play on somebody. Nothing harmful. We need it. We need a few tricks this year for sure. Thank you for being with us. And here we go. We're going to talk about, I'll introduce our guests in a few minutes, but here's some numbers. And by the way, the numbers actually got worse over the weekend. I'm still trying to figure out how Massachusetts is, doing so well per capita, because we keep hearing how its numbers are going up, right? There was 13,000 new positives over the last 7 days, bringing us up to almost 591,000 people with the virus. It's 800 more than last week, but I understand the last couple of days, it's been even more. There's been 248 deaths over the past 7 days. And so we've lost 16,746 people in our state. It's in terms of numbers for the deaths, that's similar to the previous week, though. Obviously, virus is higher than the last week. And last week, we shared 8 days data. So in terms of new numbers, I was sort of shocked that there was a slight drop nationally, because we are hearing there's a surge going on, a little bit of a surge, a mini surge. But based on the website that I always share with you, this is what it looks like. And I bet if I was able to have gotten, so it's 424,000, call it, new viruses in the nation, and 29.98 million people caught the virus, almost 30 million. And there have been 545,273 deaths. So that's up 7,000 in the past 7 days. Both are a slight drop from last week. And again, I believe, it's probably worse over the weekend. I did this, I think, on Sunday, but it was early Sunday. So the numbers probably on Monday for the weekend might be worse. Highest per capita, we're still the 2 weeks in a row: Dakotas, Rhode Island, Utah, and Tennessee. Actually, Tennessee's the one that's 2 weeks in a row. The other three have been there for weeks or months, I should say, a month and a half. And Arizona is usually right behind. They trade places. And Mass, I checked the numbers, we're 34th per capita. So I'm confused. And as you heard, New York has some big numbers, right, over the weekend, if you were listening to the news, but they, per capita wise, were not in the top 5. So obviously we expect them to have high numbers in terms of the population, but I'm sort of surprised about that. So next, what we always do is the congregate care. And this is the chart you can always download. Unfortunately, we had some deaths again in the past week. And these are figures from Wednesday. It's always like every Wednesday, these figures are released. The week before, when I shared it with you, we had no deaths. The virus numbers, are similar in terms of who's got the virus. They're down by 4, but, to me, that's sort of similar. In the community, if you take the state operated and the private providers, 39 individuals have COVID. At the state institutions, 0 individuals had COVID. Less than 5 deaths reported, as I said. In terms of positives, those are your percentages in terms of, given the size of the system. Obviously the providers that are private would have a much lower present virus. And then in terms of how many overall have caught the virus over the past.
You're muted.
What happened?
You're mute.
Leo, you're muted.
Somebody's muting me. It wasn't me. My hands are on my knees. It's Kerry. I think Kerry says sometimes she moves her arm across the screen to take care of something and it just automatically mutes. Sorry about that. So the numbers in the community, I don't know where I lost you, But what's interesting is the recovery numbers tell us how many people have the virus in our system, right? And what's odd is until a few weeks ago, or until even this week, I didn't notice this till recently, till this week. The state op actually has a higher recovery percentage, which implies a higher percentage of people there caught the virus. The private systems at 20%, which until I would say a month ago or 2 months ago, the state operating system had a smaller recovery percentage. So again, I mean, basically, we're hoping to get out of this. People are vaccinated now, so we should hopefully see less of people catching the virus. Keep our fingers crossed. Facilities-wise recovery, those are some interesting numbers. They don't have the virus right now. They've been able to stop it in terms of people living there. Some staff do have the viruses, but you can see they're pretty high percentage-wise. When you're in a big facility, there's a lot of give and take. Almost 60% at Hogan had gotten it, 40% at Rentham. And then I compared them to Shattuck, just so you could see a comparison with another institution, and they're below 30%. So it's just giving you a sense of what people went through. The larger the place, probably the more at risk you were of catching the virus. Okay, so talking about catching the virus, we're trying one last time to get our constituents a little earlier in the vaccine. Channel 5 recorded a story with Maura Sullivan yesterday night. It was on twice on Channel 5. We sent one more communication this time to two of the legislative members of the COVID task force. And it's a very short letter this time. And just, not that our letters were very long, but this is like less than a page. And it just quotes two science articles. At this point, we'd be happy if we get it people prioritized for April 5th, because we don't want people scrambling against other people. And then, of course, the other issues we continue to advocate for. But I also want to remind people, please sign up, pre-register, because that makes such a difference in getting in line. So, and here are the two articles. I guess I put them in. Just basically the devastating New England Journal of Medicine, the catalyst commentary, devastating impact of COVID-19, individuals with intellectual disabilities in the US. Then you do mention in the article, people with intellectual and developmental disabilities later it's a commentary. It's based on research that they collected. And then Lancet, of course, famous scientific, organization and journal, quote, more severe illness, greater risk of hospitalization, and almost twice the case fatality rates for individuals aged 18 to 74. It's pretty powerful stuff. So we made it simple and just basically sent the scientific information. So, it's our last shot. So I'm pleased to have with us today two leaders, Anne-Marie Bajwa, who's the president and CEO of Charles River Center. And geez, years fly by. She's been in leadership there since 2008. So that's pretty, I've known her before that time, but it's amazing to me that it's been that long there. And
well,
then
look at that picture. That's pre-COVID. Now look.
I had pretty good pictures of you. Joe's was another story. I had to go hunting, and somehow Katerina got it to work. So I wasn't going to have any pictures today because your picture had looked so much better than his. And so I finally was able to grab it off her posting. And Joe Gomes, he's senior vice president of developmental and brain injury services at Vinfen, and he's served at Vinfen since 1983. So, and of course, he happened to be there most of his career. I could, he's been elsewhere too, but I could talk about Anne-Marie's been in leadership roles at other places before that. But anyway, it's a pleasure to have both of them. I think Joe's on, right? Both of you on to talk about visitation, and I'll text.
Can I just interrupt for a minute, Leo?
Yes.
I just posted something in the chat because you were mentioning about getting people vaccinated. The White House Health Equity Policy Task Force is looking for public comment for April 1st, and I just posted in the chat the information from the AUCD policy brief. You can get more information, so you can post public comment. People might be interested in that. So I just posted that.
Thank you for sharing that. People, look in the chat. Feel free to do that. And really, would appreciate it. And And I'm going to text Joe the link I had sent him while we talk.
Yeah,
So
I don't see Joe yet on.
yeah, I was gonna, maybe let me get started first. So our issue here is really all about, and I'm gonna get out of the screen here so we could see people. Stop share, I guess, to do that. I think what we want to do, and I guess Emery, you're gonna start, is talk about, people have been concerned about visitation for a number of weeks. The second surge really had an impact, right? And caused a tightening up. You want to share a little bit about what you guys are doing and give your perspective. And as you're doing that, I'm half listening and half texting him to make sure he gets on with his link. Go ahead.
Yeah, so hi, everybody. I hope everybody's doing well. I see somebody I know there, Anna. Good to see you. It's been a number of years. At the Charles River Center, we revised our visitation policy, and feel free to interrupt me if you have any questions. We revised our visitation policy effective March 16th. And we picked that date because that marked the 2-week period after mass vaccination of our residents and staff. So in theory, they were the highest, that's the point at which you begin the highest level of protection. So we revised our policy, and so some of the highlights really is about if you take somebody out for an overnight, your family or somebody you know, a resident of ours for an overnight, we no longer required a negative COVID test to return into the group home. So that was new because prior to that, in the height of the pandemic, when we did allow overnight visits, you had to produce a negative test results in order to come back, to allow the person to come back into the group home. And so that was a welcome reprieve. Additionally, we allow, and we always did continue to allow, for in-person visitation in the group home. We never allowed it when it's a quarantine home, when the home is quarantined, of course. But we have always allowed families to come in for a very short period of time. Initially, it was for like an hour after being screened at the door, after a pre-arrangement of the time frame of what you would be doing, kind of a thing. It was for an hour up to 2 times a week. We let them come in. So now we loosen that up even further to allow people to come into the group homes to do their visitation, often to switch out seasonal clothing or check on supplies and that kind of thing, whatever they want to do. And now, it's up to 2 hours at a time, at least twice a week. And the only reason why we put any kind of limitation on it is out of fairness, right? So that if families choose, say there's 5 residents and 3 families choose to visit at the same time, that could be problematic as to where they're going to visit to stay away from the other residents, right? Of course, all the visitors need the required PPE and all that stuff. That still continues. No sharing of food, that kind of thing, that still continues. And we also have always allowed outside visitation. It's not something that anybody really wanted to do in the middle of the winter, but certainly as the weather started to get warmer, we were getting we're allowing the outside visitation, of course. So that pretty much, summarizes what has changed and how we've loosened up, if you will, in the new normal, as they call it. So if you have any questions, I'm happy to entertain them. And I do realize that each agency has, the EOHHS guidance around visitation, and then depending on the configuration of the house, maybe how many people live in the house. We have some group homes still with 8 or 9 people and down to 4. There needs to be some consideration for these differences in the environment in our visitation policy. So that's pretty much what we've done.
So I want to ask you, Anne Marie, and you don't have to get really specific with data because I didn't ask you to be prepared with this, but you said the change came on March 16th. So you guys experienced the surge, second surge as well, right?
Yes.
And what can you share with people a little bit of the mentality? Because I know you've been more flexible, but why not only you, but other providers may worry about the visitation, you know, because sometimes families will say, well, look, you know, staff are leaving and coming back, and, you know, and maybe you could share with them what's, for the people that might have been tighter than you were about this, what's going on in the thinking.
Yeah, so again, it depends on the environment, and it also, you know, so we loosened up a little and other people are more rigid. And I think based on the prevalency in the region that you're in, that has a lot to do with it. And I know staff have come and gone, but that's sort of the necessary part of what we do. And if knowing that that's a risk, if we can control all other elements of risk, then it overall minimizes the risk. And all the way along, each time we changed our visitation policy, either tightened it or loosened it, we kept track of the data to see if there was any substantial change in what was happening. And every time I write a visitation policy, I says this is based on, you know, what we see in the current data, and it may be changing in the future. So we all want to loosen up, right? But we also see Leo's numbers show a spike. You hear it on the national news, the variants, the spring breakers who are coming back. I think spring break was last week. I don't know.
Yes. Yeah.
Right. So they're coming back, and maybe that's a cause for some of the stuff. So we still have to be vigilant about this. But that accounts for some of the differences, I would say, Leo, is what's happening in the region. You know, none of us like to limit visitation with families. It's not a fun thing. It's one of the hardest decisions I've had to make all along through this pandemic. It's caused me the most personal turmoil, because I can certainly appreciate what families and their loved ones are going through.
Thank you. Thanks for answering that. And then there's a question in the chat. Are non-family members allowed in their homes, or still outside only? Just curious how that varies.
Non-family members can come into our group homes, subject to all the same screening and PPE and so forth and so on. We limit it to 2 at a time. So 2 people visiting 1 resident at a time indoors.
Okay.
Sometimes you get calls from families, it's their birthday, can I bring 3? Can we go outside with 5? You know, that kind of thing.
Right, right. And in terms of visitation to the families' homes, I know the policy historically was a negative test, right? Before you come back. How's that changed or not changed?
So we no longer require a test to come back. So, but we do ask that you still do the masking in your residence, in your home, if you can. We don't get into who's vaccinated and who doesn't, because it's so varied. You know, the resident vaccinated, the family not, vice versa. So social distancing, mask wearing, sleeping separate from others if possible. You know, meals, you shouldn't share utensils, don't eat family style, everybody has their own plate, you know, all of those same precautions are in place. The only difference is we're not requiring a negative test to come back, because all but 1 of our 133 residents received the vaccine.
Okay, so you felt pretty good. And was that March 16th too, or once the vaccines were administered?
Yeah, no, so March 16th marked the 2-week point for the last one that was vaccinated. Some others were vaccinated 3 and 4 weeks in advance.
Okay. Yeah, and people should appreciate that too, right? It was different for different agencies in terms of timing of the vaccine, and so
Well,
yeah. So
additionally, some people couldn't get it because they were sick, or, you know, not far enough after a COVID experience. So there were some staggered vaccinations, even within each agency.
before we shoot another question at you from Anna and Diane, I'm going to ask Joe. And Joe, I already introduced you. How are you? Welcome. And you got to unmute yourself, by the way. And glad to have you with us. Welcome.
I appreciate it.
Everyone knows how long you've been
coming on. I was having problems connecting.
Okay, well, I'm glad you got on. And by the way, hey, I recognize that picture artwork behind you, by the way. But
I'm actually sitting in your wife's office. They're using my office for budget development. So
okay, great to have. Thanks for stepping away from that.
I figured you would appreciate the environment.
Yeah, I do. I do. Yeah, I haven't seen that in a long time. So great to have you with. And I told people how you've been in leadership since 1983 at Vinfen, which, I assume the information's correct on the website. So
I was only 8 when I started.
that was good.
Right,
So
Ann?
Anne Marie did a great presentation about what they're doing in terms of, visitation and stuff. Do you want to share a little bit about what you're doing now and sort of when that changed, because you too went through a surge like everybody else, right? A second surge. Which,
Right. And I think it pretty much probably parallels what other people were doing as well. Very with a close eye to CDC and the guidance that the state was providing. But we did have quite a bit of activity, especially in the second surge, with a lot of positives, both people supported and our staff. So we locked it down right around the holidays and did not allow visitations at all. And we're encouraging people not to go home during those periods of time, and had some re-entry criteria. So if families chose to bring their family member home, they were to not only produce a negative test, but would need to quarantine until they were able to produce a negative test for 10 to 14 days. We did have some folks that chose to take their family members home, and many of them have kept their family members home for quite a while. And we had a few people that had been at home since the beginning of the pandemic. So we locked it down until about March 8th, until we were able to get the majority of our folks vaccinated. I think we only have, out of the almost 500 residential clients or individuals supported, we only have about a dozen that chose not to get the vaccination. So we were very confident that the majority of the people had been vaccinated, and not as successful with our staff. We're probably in the mid to high 50 percentile of our staff, and we also did clinics for our day programs as well, and we share a lot of individuals in common, so that was helpful as well. And we had pretty much success. We've had a number of clinics for vaccinating not only our staff, but also our residential staff, but also our day staff and our other ancillary services. And we're just finishing up one of the last clinics that we did internally. And we did that with Pelham, and obviously we've taken advantage of the Pfizer with the CVS. So we are doing well as far as getting people to be vaccinated.
You hosted your own clinics, so that were you able to, when, because a lot of times I would hear from people, oh, we don't have enough people, we don't want to see the vaccine get wasted. Were you able to bring in some other people you serve that were not in your residences or
we did, especially we did, as I mentioned, the day services, and obviously we have a lot of clubhouses through our mental health division.
Yeah.
So we included a lot of people that were not able to be supported. For example, a lot of our in-home support folks, if we had extra doses beyond the staff and the people within those day programs, we opened it up to other services as well.
Great.
We were able to be very successful in maximizing out the vaccines that we did have through that. As you know, a lot of our residential homes had gone through the federal program, and the people that wanted vaccines during that period, we had clinics in most of our homes, and we're able to get through those staff that wanted the vaccine, and as I mentioned, the high majority of the people that lived in our homes.
So that's great. So once you had that, you were saying somewhere around the beginning of March, that all was coming together, right? And
Yeah.
how did you change? What changed? What is the visitation policy now in terms of what?
Right now, we are allowing families to come in to the homes. One family with no more than 2 people per day, meaning at a time. So in one visit per week. And again, to give people an opportunity to be able to visit their loved ones. We are also allowing families to take their family members home if they so choose to. So we are doing still a lot of screening. Obviously, we're practicing social distancing, mask wearing, cleaning, the whole CDC. And it we recently got the EOHHS guidelines, and we pretty much had put those guidelines in place back in March. Still doing a lot of the safe distancing and all of the recommendations, hand washing, and we do and had been doing the attestation with families that chose to take their family members home, ensuring that they were practicing all of those recommendations when they had their family members at home. So we didn't deviate very much from the guidance that we recently just received. So we're pretty much on par with what was sent out last week.
So and that's been for a few weeks, and I know Anne Marie says they look at their data in terms of the impact of that, and you guys must too. Anything, how has that looked since you started?
Well, we track that data very closely. We haven't had a positive person supported in over 10 weeks.
Okay.
We've had a couple of staff test positive, but we typically either positive or some kind of contact. We're still testing our staff on a regular basis, and we chose to not only test our mandated folks in the ALTR, we're testing our day program staff as well.
Okay, and just for people on the ALTR, because that's the term now for the community congregate homes.
Sorry,
it's called.
I
know it's life, right? Alternative living was a long-term alternative. I can't even remember. See, I'm embarrassed.
Long-term residential.
Thanks, Anne Marie. So, but it's funny, we didn't know that term till what? 12 years ago, 10 years ago? Yeah, it's crazy. So there was a question Anne Marie already answered. I'm going to throw at you. What about non-family visitation to the houses or apartments?
Well, friends. So that included family and friends.
Okay.
So and if they were people that were part of their social network, we are not making a distinction between that. But we're still the same mandates: no more than 2 people, and 1 visit at a time. And we try to restrict it to the once a week.
Okay. You mentioned day earlier, but you just meant at the time. 2 people. You can have 2 visits a day if the staff can manage it, as long as they're not there at the same time. Correct?
Correct.
Okay.
Yep.
And I have a question for both of you. I'll let you answer it first, Joe, and then we'll ask Anne Marie to answer it. Anne and Diane asked, could you entertain a CAB citizen advisory visit at this time if visitors are vaccinated? So you know how the CABs do group home visits and ALTR visits, whatever we want to call them. Is that, I don't even know if it's happening now, but is that something, Joe?
We've just really moved a lot of our ancillary supports like nursing and clinicians. It had been pretty much, unless there were extreme cases that there needed to be on site. We've been doing face-to-face the entire time for those services that were necessary through our family support, through our individual ancillary supports. I just lost you. Okay.
No, we
So we've been doing face-to-face. We Obviously, we would make sure people had the proper PPE, masks, KN95s as necessary, shields. So our staff have been doing face-to-face pretty much all along. But if it was unnecessary, they would pretty much be doing those kinds of supports virtually. A lot of our audit processes have been virtually. But obviously, we still have VNAs coming in. We still have outside people coming in. And we're following the same protocols around making sure that they are wearing the proper PPE, and we're doing the continued screenings for any visitors coming into the homes.
But in terms of DDS, like you're saying, you have your own internal audits for quality, right? Mine, that's what you were referencing,
Yeah.
audits. But in terms of a DDS group coming in, QE, family citizen.
They, again, if it can't be done virtually, a lot of it's still been virtual. For pre-sighting, for example, we try to do it virtually, or we work it so that people can do it without individuals being in the home. But still, a lot of that's still being virtual. We not had the opportunity to make a determination whether that would be advisable at this particular point or not. And I think with the new CDC around people that are vaccinated, a lot more freedom if both parties have been vaccinated. So I would consider that if in fact there was proof that the person was vaccinated.
Okay. And Marie, how about you and family citizen monitoring and stuff?
I think very shortly we'll welcome the in-person citizen monitoring. Again, we'll watch to see what the data shows just right before that visit is scheduled. But I think as much as we can get back to the norm, the better we'll all be. So yes, I would entertain that.
But I'm assuming neither of you have been approached, right, for a live visit from QE or family citizen. Anne-Marie, you first, then Joe. Have you even been approached?
Yeah, they're doing it all virtually right now. ISPs even, so forth. Everything is pretty much virtual. So that's their
Guidance.
yeah, their guidance, not ours. So I
Yeah,
think
we're just starting to, even for face-to-face training, we're just starting that. So it's been pretty much status quo. As we hopefully this trend will continue going in the right direction. We'll probably need to start attending to some of those things that have been backlogged for this past year. Safety care training, MAP training, all of those things are lagging, and we're in much desperate need of getting back to a more normal schedule.
So in the MAP, for those of you on the Zoom, MAP is related to medication administration. So which was a big deal for a while of trying to get it done virtually. I remember in the heat of this, figuring out something, right? So people wouldn't be judged non-compliant, right? With those kinds of requirements. And then you'd have new staff. You'd be bringing on both of you, right?
Mhm.
That would not necessarily that, so we won't get into that. It's a whole different topic. My God, we could get it to like 20 topics and not be done until 10 p.m. I was going to ask about the training piece. You're going to face, so Joe, you heard Joe say about they're a little above 50% staff vaccinated. I won't ask you your number, but I know it's been hard across the state. And some people have had it easier. It sort of strikes, I was sort of shocked at how high some of the numbers were in one of our meetings a few weeks ago from some of our colleagues. But Joe, you're saying you've gone to face-to-face training and 40% of your staff don't have, right? I haven't been vaccinated. How does that, they still wear masks at the training, I assume, and all of that?
Yeah, and I think part of the new strategy is we're doing a lot more testing. So prior to the test, they need to get a negative test. Obviously, the vaccinated folks are less of an issue. So we're still doing, we're heightening the monitoring of people's status prior to the trainings.
Okay.
We're not just throwing people together. We're taking precautions to make sure that they're testing negative before we bring them all together. our instructor. We're really pushing our instructors for the various courses to be vaccinated. We're doing a lot of our training in pods, so we're not having people from 40 different sites coming together. We're doing it in clusters, geographical clusters, so that we, again, can minimize the crossover from the different cohorts. And because we do have geographical regions, we're able to schedule those trainings in the regional centers that correspond with those cohorts.
Gotcha.
So, and even minimizing it further, if, for example, for safety care, we may limit that to 3 or 4 residents that require those trainings, and do a class of 10 from those 3 residences, as opposed to having people coming from 10 or 12 different residences. So we're trying to keep those cohorts small.
Okay. And how about you, Anne Marie, on the training piece?
Yeah, so we're a lot smaller than Vinfen, so we're just throwing people together. So yeah, we've been doing training for about, I would say, the beginning of March, maybe late February. So we were trying to clear up the backlog with CPR, first aid, MAP, safety care, and all the other trainings. So we're doing a combination. Anytime we can do a virtual component to the training, we're doing that first, and then limiting the face-to-face contact for the rest of the training. So for instance, like first CPR, you can do it online, and then you come for 20 minutes and do the practical part, and somebody sort of judges you on that. Anytime we're coming in contact, physical contact with each other as trainees, we are in full PPE, gowns, gloves, the whole 9, masks, sometimes shields if it's a safety care. So we're really taking their health and safety. We have a huge training space with ample space that we can hold upwards of 15 if we have to, but we're only going as high as 10. So we've made a considerable effort to get a training plan out there. They tell me by May, June, we will be completely through our backlog of trainings that weren't able to be done on the face-to-face training. So I'm really happy about that. But it's a lot to manage for sure. Yeah.
I think those are examples of things I wanted to touch on, that it wasn't germane to the presentation, because it just shows it is germane in the sense that for you to have visiting, right, you feel like staff know what they're doing and everyone's following your protocols, you need training.
Yes.
And I think it's easy to forget that, and the human element, right, that you face as leaders, and trying to make sure that you've done everything you can to help make sure that human element kicks in the right way. Does anybody else want to raise anything about, obviously I have 2 organizations here that are somewhat flexible about visitation. You can see Joe's, maybe you didn't get to hear Anne Marie, she's allowing 2 times a week, but you're in the same you're in the flexibility ballpark. I can't hear you, unmute yourself. He had a joke there, but we didn't get it because he was on mute.
No one ever gets my jokes. She's a lot kinder than I am.
Yeah.
Okay. There you go. And you've both had family meetings, right? By the way.
Yep.
We do.
Yeah. And how does, you've benefited from those in terms of their feedback and trying to,
Always.
Yeah.
They're always so informative, and listening to people, what they're going through, really helps inform our policies and procedures, honestly.
Yeah. And Joe, you too?
Yeah, similarly, is that we look forward to the feedback, and also to share information with them. They want to know about how we're doing as an agency as far as positivity, and some of the steps that we've taken to kind of streamline some of our supports, and also the measures that we're taking to safeguard their family members and the staff that work with them.
Yeah.
So it's been very two-way, very informative. Most of the time it's just it's not just us providing information, but a two-way discussion. And we also have a family counselor that is very active and trying to work with us about sharing their perspective and what things we should be communicating with families and what's important to them. So it's been a very positive experience.
Great, great. Anybody else have another question for Anne Marie or Joe or for both of them? Because we're getting, it's 12:41, go to 12:45. I don't want to hog the time. Yeah.
And typically, we usually have a lot of questions from Anne.
Yeah.
She's awfully quiet today.
In fact, Anne used to work with you guys, right?
Yeah,
For
many years ago. Yeah.
Yeah.
So, and there's nothing else in the chat. Wow. Okay. Any looking forward over the next 8 weeks, assuming we don't go crazy with a variant or the surge? Anne-Marie, first, you want to go? Do you have anything in the crystal ball you want to share in terms of?
Yeah, and my husband was like fixing the chainsaw. Did you hear that? He was trying
Oh, no, we missed it. You
to
were quick. You were quick.
So no, I mean, we're just taking a look at, we're staying abreast of all the news and all the guidance, and you know, we hope that the surge isn't going to hit us in any big way. Like Joe said, it's been several months since we had a resident test positive, which I'm so thankful for. But you know, what I've said to the people is get out, enjoy the sun. I know it's helping me tremendously to decompress and sort of get ready for spring. So get the folks out as soon as possible. Let's begin some, you know, regular outdoor activities. So I'm just very, very positive for the future. We just always, you know, have to watch the numbers.
Right, right. And then you, Joe?
I think the similar kind of precautions. I think we're moving forward cautiously, and I think it's we want to give people a sense of the new norm and some additional freedoms, but at the same time, as Anne Marie said, keeping our eye on the numbers to make sure that we don't find ourselves going backwards. So it's slow and steady is what we're kind of prescribing to at this particular point.
And we just had two sort of questions, and one I can answer part of it. There were Carol was asking what kind of meetings do the heads of different agencies have together, and they actually have a trade organization called ADDP that's been very, I would say, proactive, right, during this period. So that's one vehicle, and then we actually have something for our chapters that's been going on since the crisis hit. But I'd say ADDP is the key place in terms of, you know, folks sharing stuff in terms of working with the state, guidances, and there's different subgroups in there. So I answer that for you guys. ADDP stands for Association of Developmental Disability Professionals, Providers. Oh my God, I'm losing it. ALTR and now ADDP. And then Carolyn asked, how have your medical visits occurred? And then there's the last question about workforce, if your day programs are going to open, and we'll end it after one of you answer the medical visits and one of you answer staff as your day programs open wider. So which one do you want to take? Joe and Anne-Marie. Oh, Anne-Marie, you want to go first? Go ahead.
I'll take the staff. So,
Okay.
so relative to the day programs and the staff, you hit it right on the nail right on the head. That is one of the problems, is we're still in a workforce crisis. And so recruiting staff to reopen day programs to the capacity we would like to, maintaining 6-foot distancing, is a challenge because we're still doing remote services, we're still doing in-home services, and now we're doing opening up the day programs. So yes, I just met with my team this morning. It's a bit of a balance. It's sort of eking towards the goals, and then a lot of recruitment. Absolutely, that is a challenge.
And you still have the restrictions, so it's not like you can fill the place up yet anyway. But if you did, you'd have a challenging situation.
We have restrictions and barriers relative to transportation. State-funded transportation is still very, very limited. So there's that restriction. Additionally, we have to configure our buildings to fit 6-foot distancing between the program participants. And depending on what your space, how your space is configured, you can only get to a certain capacity and still maintain that safety. So it's not 100%, not even close.
Okay. And Joe, do you want to tackle the medical question?
Is it still 6-foot distancing, even though schools could be at 3-foot
Yes.
distancing?
Yes. Yeah. They're easier on kids because kids have been more impervious to the virus somehow. Yeah.
Yes.
Yeah, we're hoping that we get some relief. It's not just the 6-foot, it's the capacity. We need 113 square feet per body, including.
No, that's
I'm
changed. That's changed.
Yeah, I was going to make that point.
Oh,
Sorry. So we have gotten some relief in that we now can adjust our capacity. We had been operating our 9-day programs at about a 40% capacity. So with increasing that amount a little bit, it'll give us some relief since we don't need to go by that 113. We may even get beyond 50 or 60%. But it's been difficult, and as Anne Marie said, recruiting staff back is going to be a big challenge. And I know transportation had initially been an obstacle for us, but we've actually been doing pretty well, I think, gradually improving over time. And to answer the other question about medical appointments, a lot of them still being done virtually. Obviously, those that need to see their physicians in person, we work with the physician's office to get the person there. Again, PPE for everyone concerned, and making sure that we're as cautious as possible when visiting. We rolled out a lot of technology during this period, iPads and computers, and have pretty much made sure that each of our residential programs had the equipment that they needed in order to engage in telehealth and remote services. So in a home where it has 4 people, there's competing priorities for that remote services and the telehealth, because everybody wants to be able to have the access to their services, but it was difficult if you didn't have the technology. So we're working on that and making sure that everybody has what they need.
Great. All right. And one last thing, not for a question, but just someone sharing how they hope the transportation continues to improve because of, the problems of getting folks out of the house. So, hey, you guys have been great. Anne Marie, Joe, I really think you've been informative for us. And clearly a whole bunch of questions came in at the end there as well. But I think you answered so much. Your answers were so full and thorough, and your description of the situation. So it really is helpful. And people will see the recording of this as well. So again, we've had with us Anne Marie Bajwa of Charles River Center and Joe Gomes of Vinfen. Really appreciated. Great partners of the ARC as well. Obviously, Charles River being a chapter for 70 years, 70 something years, God knows how long, and Vinfen being a sponsor member supporter for at least 25 years. So with us, so it's really appreciate being with us, and just great working relationships as well. And you guys, thank you for everything you do for our community. Really appreciate it.
Thank you.
You're welcome. Thank you.
Thank
All
you.
right, everybody. And I just want to welcome everybody next week, as well as I think we have guests this Thursday, right, Kerry? For, I think, Congress. Oh, my God. We're going to have Senator Warren staff person with us again, Susanna. And
Yes.
she's going to talk about, maybe she'll talk about the 10%. Massachusetts is scheduled to get $400 million. So I finally found this chart that I've been looking for. And of that, we know specifically related to our community, it's probably around 100 million. But there's the elders as well as other communities, as well as some of the community-based services in Mass Health have been covered by this as well. So it's really a time which I did not expect when I first heard the words home and community-based services. So really an exciting time. So I hope Thursday, that's at noon. Suzanne will join them, talk about a few things on the federal front. And thanks, everybody. Have a great week. See you next week. Thanks again, Joe.
Thank you. Bye.
Bye-bye.
Bye.
Yeah.
Bye-bye. Take care.
Bye.
Bye, Josh. Take care. Bye, Ann. Bye, Ann.